Welcome everyone to the VA SAVE training. So before we begin, I want to start off by saying that suicide is an intense topic, and today we will discuss ways that everyone can contribute to a safer environment for veterans at risk and even for our community at large who are at risk for suicide. So we know that this is a very sensitive topic and that people in attendance today may have had personal experiences involving suicide. If you find that you need to take a break, please do so. And please feel free to reach out to myself or Mr. Downs at the end of the presentation if you would like to just hear some more information or would like to hear about some resources that are available in the community. Of course, if you feel like you want to talk to someone at any time or also want to provide our Veterans Crisis Line, and also that this line is also available for individuals who are non-veterans. We have this number here on the slide, and you would press 1 to connect with the Veterans Crisis Line. And they are all trained responders who respond to calls 24/7. We should all have this number available to provide to people that we are working with, and also to our friends and family and community at large. So just a little bit of overview of what we're going to be talking about today. So first, we're going to go over our objectives and go over facts about veteran suicide and also common myths versus realities and the VA SAVE steps. We're going to go over that acronym, and then we're going to go over some local resources and resources at large, which are available not only to veterans, but also to the community. Because really what this training is that it is a gatekeeper training, and it's provided to train everyone who either knows a veteran or knows someone who is at risk for suicide to provide immediate support. And we're going to enable you with those tools to be able to do so. So as I said, one of the objectives that we're going to learn about today is have a general understanding of the scope of the veteran suicide within the US, and know how to identify someone who may be at risk, and know what to do when you identify someone who is at risk. I want you all to take a moment to consider, what are your biggest questions surrounding suicide and talking to people in crisis? We're going to go over some few scenarios that may apply to the population that you serve. So I'd like you to really take that time to even think about some potential questions that you may have. So facts about veteran suicide. So I don't know if you all know that suicide is a national issue with rising rates of suicide in the general population. In addition, suicide rates are higher and are rising faster among veterans than among non-veteran adults. Societal factors such as economic disparities, race, ethnicity, and LGBTQIA disparities, homelessness, social connection and isolation, and health and well-being play additional roles in suicide. And not only would we think about the recent and currently ongoing COVID-19 pandemic, which has placed an additional strain on our nation and our individuals and communities at large. So one thing that I would like for you all to consider is that suicide is a complex issue with no single cause. It's often the result of interaction of risk and protective factors at the individual, community, and societal levels. And also risk factors are characteristics that are associated with an increased likelihood of suicidal behaviors. Now, when we think about what are reasons to live, what we would say are our protective factors can help offset the risk factors. So to prevent veteran suicide and to prevent our non-veteran suicide, we must maximize our protective factors while minimizing our risk factors at all levels throughout communities nationwide. I want you all to think about what are some potential risks and those factors that are enable someone to continue on living, or what we would call our protective factors. Now, here are some of our list of that we see amongst not only amongst our veterans, but like I said, our community at large. And like I said, these risk factors are associated with an increased likelihood of engaging in suicidal behaviors. Now, some risk factors may include prior suicide attempt, mental health issues, increasing or worsening substance abuse, access to lethal means, recent loss, legal or financial challenges, relationship issues, unemployment, and homelessness. And also what we have noticed in recent research that are also risk factors of suicide are chronic pain management issues, like those experiencing chronic pain, and also those who are experiencing sleep issues. Or to think about those individuals who suffer from TBI, traumatic brain injury. Those are also potential risk factors for suicide. Now, when you think about what are the reasons for living and what are our protective factors? So, their access to mental health care or to even care in general. Think about our sense of belonging and connectedness, problem solving skills, spirituality, mission or purpose, physical health, employment, and social and emotional well being. And also think about also positive coping skills. And of course, this list does not include all of what we would say are these protective factors and reasons for living. They're all individualized, and you want to find out from people that you are serving how can they identify these factors and reasons for living. So now we're going to go into some key findings from our 2021 National Veteran Suicide Prevention Annual Report. We're going to go over some statistics today. So we have a context of why this is a huge problem. So when we think about our veterans, 6,261 veterans died by suicide in 2019, compared with 6,660 in 2018. So veterans accounted for 5,989 suicides in 2001, which represented 20.2% of suicides among US adults in 2001 and 6,261 suicides in 2019, which by comparison represented 13.7% of suicides among US adults in 2019. So from 2018 to 2019, changes in age and sex adjusted suicide mortality rates. The veterans, there was a 7.2% decrease, and for non veteran adults, it was a 1.8% decrease. So in 2019, as you can see from this slide, that adjusted suicide rates were 152% greater for veteran men than veteran women. And the rates for veteran men were highest in 2018 and fell to 3.8% in 2019. And rates for women were highest in 2017 and fell in 2018 and again in 2019, which represented a 14.9 decrease relative to 2018. Now, at this side, we're looking at with the suicide deaths, what were the methods that were involved? So as you can see, firearms accounted for 70.2% of male veteran suicides in 2019. That was up from 69.6% in 2018 and 49.8% of female veteran suicides in 2019. And that's up from 41.1% in 2018. Now, if you can take a look at this slide, you will see, as you see here, that firearm deaths lead the cause for suicide. And then second is poisoning. And then third is suffocation. And then we have under other, usually what sometimes means we've said hanging or what someone would use either some sort of like a jumping from height or some other classifications of suicide deaths. Those are the most common in the other section, hanging or using some sort of rope to tie from a ligature, um, some sort of way to restrain yourself in terms of like hanging oneself and jumping from height. So now we're going to talk about what's very important, which is lethal means safety and how to have a conversation with someone who has access to lethal means. Ronald?
Good afternoon, everyone. So what is lethal means safety? In the context of suicide prevention, safe storage of lethal means is any action that builds that time and space between a suicidal impulse and the ability to harm oneself. Effective lethal means safety education and counseling is a collaborative and veteran-centered. It respects the important role that firearms and medication may play in veterans' lives and is consistent with their values and priorities. So what are some methods that we can employ for lethal means safety? Perhaps a pillbox organizer, a medication lockbox, discarding of excess medication, enlisting assistance from a friend or a family member to supervise someone's medication intake, surrendering a firearm to the local police station with a program called Cash for Guns, which gives $200 for everyone who wants to anonymously give a discard of their firearm, removing knives and sharps and other objects from your home, giving your car keys to friends or families, or keeping your balcony locked. Next slide, Allison. So building in that time and space between the impulse to act and the means to harm oneself could save someone's lives. While some suicidal crises last a long time, most last minutes to hours. In one study of suicide attempt survivors, 47% said it took less than 1 hour between their decision to attempt suicide and their actual attempt. 24% said it took less than 5 minutes for them to act. The time between when a person decides to die by suicide and they act on the decision is very often short. A 2005 study found that 71% of attempters estimated that the process took less than an hour. This reality underscores the importance of reducing access to means for those who are at elevated risk for suicide until that risk period has passed. So access to lethal means increases suicide risk for everyone living in the home. And we should know that that acute phase of a suicidal crisis is often brief. But building in that time and space, even 30 minutes to 60 minutes between impulse to act and the means to harm oneself saves lives. And we know also that people rarely substitute one means for another. So it is important to restrict whichever means they have in mind to use. Again, means matter. How a person attempts suicide impacts how fatal the injury will be. And about 90% of firearm-related suicide attempts are fatal as compared to approximately 5% of suicide attempts by all other mechanisms combined, as you can see in the chart on the right. Most who survive a non-fatal suicide attempt do not go on to die by suicide. Next slide. Next slide. So lethal means safety works. As we said, reducing the access to the lethal suicide method is one of the few population level interventions that has been shown to decrease suicide rates. And about 90% of people who survive a suicide attempt do not go on to die by suicide. If we can collaborate with the veteran ahead of time to help them survive a suicidal crisis, we have likely prevented suicide for the rest of their lives. Moving on here. So essentially, suicide is preventable. And now we will go over the common myths and realities about suicide. So one thing I would say before that is even though suicide is a major public health concern, there are a lot of common myths and misinformation about suicide. So we want to talk about what some of those are. So here is one. People who talk about suicide are just seeking attention. So we know this is a myth. The reality is, no matter how casually or jokingly said, suicidal threats should never be ignored and may indicate serious suicidal feelings. Someone who talks about suicide actually provides others an opportunity to intervene before the suicidal behavior occurs. And here's another myth. The only one who can really help someone who is suicidal is a mental health counselor or therapist. We know this is a myth because in reality, anyone is able to help. Special training is not required to safely raise the subject of suicide. Helping someone feel included and showing genuine, heartfelt support can also make a big difference during a very challenging time.
I'm sorry. Thank you, Ronald. So now we're going to talk about the steps of VA SAVE, and we're going to go into in depth about this acronym. So what is VA SAVE? So VA SAVE is teaching communities at large how to help veterans and even people who are non-veterans at risk for suicide. VA SAVE will help you act with care and compassion if you encounter someone who's in a suicidal crisis. So what does the S stands for? The S stands for signs of suicidal thinking that should be recognized. A, how to ask the most important question of all. V, validate the veteran's experience. And E, encourage treatment and expedite getting help. So now we're going to go into what are some common signs of suicidal thinking. Now, I want you all to know this is not an exhaustive list, that we do not have all the signs of suicidal thinking on this slide. So even think about the cases that you encounter where you would think of, okay, this is someone who is at risk. So you want to learn how to recognize some of these warning signs. So the main one is hopelessness, feeling like there's no way out, anxiety, agitation, sleeplessness, or mood swings, feeling like there's no reason to live, rage or anger, engaging in risky activities. So think about impulsive behavior, increasing alcohol or drug use, withdrawing from family and friends, so someone who is isolative, thinking about those who are even giving away items. That's another sign of suicidal thinking. The presence of any of those following signs requires immediate attention. Thinking about hurting or killing themselves, looking for ways to die, and the community we call that preparatory behavior. Talking about death, dying, or suicide, so any suicidal communication, any self-destructive or risk-taking behavior, especially when it involves alcohol, drugs, or weapons. So how do we ask the question? So know how to ask the most important question of all. Are you thinking about killing yourselves? So when we think about asking the question, we're looking at some do's and don'ts to engage someone who is thinking about suicide. You want to use direct words and phrases such as killing yourself and suicide when asking about suicidal thoughts. Avoid using vague phrases such as hurting yourself, as these can have different meanings to different people. To emphasize this, right, you want to just really be very direct. You also want to be calm and you want to be natural, have it flow with the conversation. You want to avoid asking in an indirect way, but be direct and also show that that you're curious about, okay, what is happening with this particular person. Because when the patient or when the client hears that you are asking and wanting to know what's going on, it provides that invitation to be open right? And to provide what's weighing heavily on their mind and what they're thinking about. You don't want to ask the questions that you're looking for a no answer, like you aren't thinking of killing yourself, are you? And you don't want to wait to ask the question when someone is halfway out the door. When you ask very directly, you are giving an invitation, right, to really engage in what's going on with this particular person, right? And really asking about that person's risk for suicide. For example, you want to say, I want to better understand what you mean by ending it all. If they're saying, oh, like if someone comes in and talking about their homeless issues and they said, you know what, I might as well just end it all. You want to ask directly, are you thinking about killing yourself when you when with that statement? And you want to ask questions where it invites openness, like open-ended questions, and you want to remain non-judgmental, no matter the answer. This is very important as it demonstrates that you're willing to listen and you're there to elicit responses from the particular person that you're working with. And the question shouldn't be an afterthought. Excuse me. I'm sorry. The question shouldn't be asked as an afterthought, and it should be asked promptly when someone indicates that they may be at risk for suicide. So, one thing that you want to think about is even amongst your colleagues, maybe when you're having team meetings, it's like how to check in and get comfortable with asking these sort of questions. Here at the VA, we do screenings for suicide, and we often hear from providers that they feel uncomfortable with asking the question because they think it may invite the person to think about suicide and harm themselves. So, one thing that you want to think about is, like I said, is to practice being comfortable and even demonstrate how you can ask that question amongst your colleagues. Like, no matter what, as long as you're asking and being direct and non judgmental, you're able to elicit a response from the person that you are working with. And next step is, as you mentioned earlier, is you want to validate the veteran or person's experience. You want to talk openly about suicide because let's be quite honest, it's a very common thing when someone feels that they're hopeless, especially in the housing scenario. Feel like that there's no way out, there's no way to cope. And that's the easiest thing to think about. Hold on one second, please. So we want to be willing to listen and not pass judgment and reassure that help is available and recognize that anyone who comes into your office space or that you're having a telephone encounter with, and if they're expressing suicide, that it's a serious situation. So what are some examples of a validating statement, right? Like I said, it's response to an invitation statement. Like if someone says, you know, everything is so hard, I feel like a drag to my friends, or thinking about a homeless scenario where it's like I feel so hopeless. Like I had everything, I had this nice apartment, and now I have nothing. And you could say, wow, like validate by saying and showing empathy, like anyone in your situation would feel that way. Of course, you're feeling overwhelmed. You've been dealing with a lot, and this would be too much for anyone to handle. So you're really just validating that experience that they're bringing up to you. And last but not least, for the SAVE acronym, we want to encourage treatment and expedite getting help. That means no keeping secrets. If someone says they will talk to you about an issue and say only if you promise not to tell anyone, it's important to be upfront and say that you cannot make that promise because you want to make sure that they're getting the help that they so desperately need, right? You want to put them in the right direction. You want to make sure that amongst your team, you're not keeping that a secret and let someone else know, here's what's been going on for this particular person. And how can you assist with providing some support, right? And if you are in a meeting with someone and they are feeling actively suicidal, you do not want to leave him or her alone. You want to make sure that you're there. You want to connect with either the nearest hospital emergency room, either calling EMS, or you want to connect with the supervisor and see if they can support with calling EMS or 911, right? Or if they have a provider that you can connect them to, let's talk to your provider to see if they can talk to you about what's going on right now. So reassure that help is available. And also, you can always call the Veterans Crisis Line or the National Suicide Crisis Line, where you can connect with a trained responder who can also activate EMS and also provide support. It's very important when talking with a veteran at risk for suicide or anyone who's at risk for suicide, as we discussed throughout this the safe portion here, is to remain calm, listen more than you speak. You want to maintain eye contact, act with confidence, do not argue, use open body language. And you also want to allow for an open conversation. Let that person do the talking, because then you'll get to hear more about their experience and what's going on for them. You want to also be supportive and provide encouraging statements. And also, you want to be honest, especially when it comes to the homeless situation, right? That there are no quick solutions, that it is an arduous process, right? And it's going through a lot of hoops and probably even facing a lot of barriers. But that despite that, that help is available for them as they embark on this challenging process of relieving their homeless status. So what to do, let's say, for example, if you are doing screening calls, right? And someone who you're screening expresses suicidal ideation. You want to definitely remain calm. You want to keep the caller on the line. If you can, also, I would say conference call to the VCL, right? And first and foremost, you want to obtain information of the caller, their name, phone number, and where they're calling from. And if the caller disconnects, you want to call back immediately, right? And if no answer, you want to dial 911 or call the Veterans Crisis Line or the National Suicide Prevention Line. And also, you want to also enlist coworkers for assistance via instant messaging or Teams. So now we're going to go into some scenarios that would work best with your practice and your workflow on how you can best assess someone who may be at risk and how to provide support. Ronald?
Thank you, Allison. So we're going to do a couple of scenarios here, and I do welcome everyone to unmute their mics if they'd like to join in and go over the VA SAVE acronym for each scenario. I'll start off with the first scenario. Allison, could you go to the next slide? I think it's a couple more slides where the VA SAVE is on. There we go. Yes. So here's a scenario, right? Let's say you work at a homeless veteran reintegration program. You're in the process of completing the intake of your new client, Crystal, when she states, "It's been a tough week. I feel very overwhelmed. I finally moved into my new apartment with my HUD-VASH voucher a year ago, but since then I've lost my job 5 months ago. So I'm already facing eviction because of several months of arrears. My parents died of COVID a year ago. So now I am all alone in this big city. I'm depressed all the time. I feel hopeless. I just want to go home tonight, go to sleep, and never wake up. I'm at that point." So thinking about the VA SAVE acronym here that we talked about, what can anyone say as far as S, signs of suicidal thinking that should be recognized? Can anyone think of any? I can read it again here as well. So Crystal, who is one of your clients, you just completed an intake with Crystal, and
She
she,
actually states she says that she wants to go home and go to sleep and not wake up. So that right there is identifying that she no longer wants to go on.
Yes, yes, very, very, very right. That's definitely a warning sign, a sign of suicidal thinking in and of itself. Someone said in the chat, worthless feelings, feelings of hopelessness. We know that's very huge when it comes to suicidality in general, right? So any other? Withdrawing, right? Yep, yep. Feeling alone. Grief symptoms. Yes, we know that the family member, that the mom and her parents died of COVID a year ago. Financial stressors, very true. She lost her jobs. Those are very great signs that you've all have identified. Yeah. So moving on to same scenario, let's go to the next part of it, the A, asking the most important question of all. So let's say I'll read the last 2 lines of what Crystal is saying, and then someone could chime in and say what would be their follow-up question. So Crystal says, I'm depressed all the time. I feel hopeless. I just want to go home tonight, go to sleep, and never wake up. I'm at that point. What would be that question that someone would ask pertaining to suicide?
I guess just asking the question directly, Crystal, are you having thoughts of suicide?
Yes. Yes, that's very true. Very true. Yeah, I completely agree. Ask if she has a plan, someone said here. It's very true, right? Definitely, asking that most important question. You want to be very straightforward, very direct when you're asking about that. And so what we'll do is we'll go on to have you thought? Yeah, have you thought of suicide? Right? Yes. Yes. Yep. Yeah. Yes. So, and typically in that case, perhaps you want to say a validating statement before you ask that question. But for the practice, we were asking the question. But let's look at the validating statement, right? So perhaps this is what you want to do before you ask the direct question. So I'll read the last sentence again that Crystal is saying. I feel hopeless. I just want to go home tonight, go to sleep, and never wake up. I'm at that point. What would that be, that validating statement there that you can say?
I understand you're feeling hopeless.
Mm-hmm. Yeah, yeah, very true. Any other ideas?
We can say also, we understand you are in a very hard situation now, but we are here to help you.
Yes, yes, that's a great validating question statement. Yes, I understand that you were going through quite a lot, right? But we are here to help you. Reassure them that help is available. Yes, yes, very true. And the we are here to help you kind of shows that it's teamwork, right? It's a collaboration effort here. Another validating statement could be anyone in your situation would be very overwhelmed, right? That could possibly be another validating statement, right? So in this particular scenario with Crystal, we know that she's come into the office, right? So this is an in-person kind of scenario here. So moving on to E, which is expediting, encouraging treatment and expediting getting help. How would you do that? So again, the last sentence is, I feel hopeless. I just want to go home tonight, go to sleep, and never wake up. I'm at that point. What could be a statement to encourage treatment and expedite getting help? I know one was kind of said for the other one, but any thoughts?
Sorry, you asked what would be the next step.
Yeah.
Sorry, repeat your question.
Yeah, so how could you encourage treatment and expedite getting help?
You could ask, are you open to meeting with anyone that could help with your situation? Yeah.
Yeah, yeah, very true. Asking, are you, how willing are they to get help, right? Um, but also letting them know help is available, help is can be on the way. You know, that could be one thing. Perhaps maybe even asking, would you be willing if, depending on, where you are and in what facility, depending, maybe you can ask, would it be okay if I call the Veterans Crisis Line for you? Would you like to talk to someone at the Veterans Crisis Line? Because we know that there are trained professionals there 24/7 that could assist a veteran if in case you were not familiar with certain things, but that's an option, right? So someone said, I'm glad you're here. I care about you. Would you be willing to talk to someone? Yeah. Yes. Yes. Very clear, very open. Yeah. Yes. So now we can go on to scenario number 2 here. So let's say that you are living in, someone said, I would express my concern and offer recommendation to speak with someone before going home. Yes. So you do want to keep the veteran in your office, specifically because, I want to go to home tonight, go to sleep and never wake up, right? You want to be able to keep that veteran in your office to offer help and then, get that veteran the help that they need in that moment before they leave your office. So yes, very true. Yeah. Yeah. So what we could do is perhaps going to the second scenario, right? So let's say this is, you work at a transitional housing facility and you are told by several residents that they are worried about a specific veteran. Let's say this veteran's name is Sam, and Sam was reportedly released from an inpatient psychiatric facility a week ago. And he stayed at that inpatient facility for a month after an overdose. He finally comes to your office and says, I know they're all worried about me, but don't worry, I'm fine. I still wait a few hours after I drink to take my psych medications. Don't worry, I know exactly what I'm doing. It's not like I'm trying to be reunited with my dead mom, although honestly, that doesn't sound that bad right now. So going back through the SAVE acronym, right? So what are some of those signs of suicidal thinking when it comes to that specific scenario? Can anyone think of any?
Dismissive behavior.
Yes, yes. I can do with this on my own. I'm fine. Reckless behavior, right? Someone said here, right? The drinking with the psych medications, talking about suicide. Yep, yep, talking about his deceased mother, right? Those are all very important warning signs to pick up on here in this situation. The fact that there was a recent psychiatric hospitalization, that's something to kind of consider. That would be very notable in this scenario. Yeah, and the overdose, right? Recent for 1 month, yes, right? Very recent, and pretty long hospitalization, which could mean that this perhaps wasn't just, well, it's an overdose, right? So, overdoses can be at times, it's kind of hard to determine whether an overdose is accidental versus suicidal behavior sometimes, right? So, but very long hospitalization indeed for a month, right? So yeah, those are very important warning signs to kind of think about. Now A, right, asking the most important question of all. I'll read the last 2 sentences here. I still wait a few hours after I drink my psych medications. Don't worry, I know exactly what I'm doing. It's not like I'm trying to be reunited with my dead mom. Although honestly, that doesn't sound that bad right now, right? So let's say you've asked your validating question. Let's just say now, how would you ask, or you've made your validating statement. How would you ask that question about suicide? I know we went over this already, but trying to see if there's any other, are you suicidal, right? Very direct.
very direct. Are you thinking about suicide yourself? Something like
Yep.
that. Very direct.
Yep. Are you planning to hurt yourself? Are you thinking about killing yourself? Those kinds of direct questions. Yes.
You could also ask what type of space they're in mentally. That could help a lot. Because if you're not right mentally too, that could also, you know, be another reason to like go off and kill yourself right then and there as well.
Yeah. Yeah. So you're saying asking what state they are in mentally, right? So some people may not say that right away, right? They may not be willing to share that information with you, but yeah, asking if they have a plan, asking if they have intent, asking if they have access to lethal means. Those kinds of things are very important at this point. Well, we kind of know that there is some access because psych medications, right? So would they be interested in a pillbox organizer, those kinds of things? Is there anyone at home that could perhaps help with supervising their medication intake? What's happening that you're thinking about joining your mom? That's a great open question to have as well. Yeah, right. Yeah, because he's not being direct about anything, right? He's just saying, you know, I got this, don't worry about it. So there must be other things going on that are unsaid at this point. So yes, inviting that answer, yes. Yeah, yeah. So, and then more of those validating statements. Sorry, I keep on saying questions, validating statements. What could be some other validating statements that you can tell Sam?
I understand that the situation of uh, facing the death of your mother is something very serious, but the community and all the people you love are here to help you.
Yes, yes. It's a great one. It's a great validating statement to make. We're here to help you. Yes. Yeah. Yeah. Can be really difficult getting adjusted at home when you were just getting out of the hospital, right? Something important to consider as a notable care transition, as we can call it, right? Discharge from an inpatient facility could be a high risk period for suicide. We know that statistics and research shows that. So that's very true, very true. That adjusting back into being at home, right? Thanks for sharing this information with me. We are here to help. Yes, that's great. That's great. Yeah. So moving on here with E, right? Encouraging treatment and expediting getting help, right? So what could you say at that point, you know, with Sam? What resources could you possibly offer Sam? Perhaps at this transitional housing facility, there's a relationship, perhaps with a community provider that offers mental health treatment, right? That could be something in the future, right? Yep. Yep. So I have about 2 more scenarios, but I may just talk about, well, ask if he would be willing to speak with someone about his concerns. Yes, yes, very true, very true. Yes. And again, the mere fact that he's making these kinds of statements and that he's telling this to you could sometimes signal that perhaps he wants to talk further about this, right? And now I'll do the last scenario here. We'll go around with the VA S.A.V.E. and then we'll open it up to everyone for questions. So going back to this third scenario, your client's name here is Anna, right? So she calls you and she says, I've seen 5 apartments already. I don't know what's the point of doing all this house searching or home searching, apartment searching. No one seems to get me, and no one is really trying to help me. Things were easier when I was in the military. Maybe I should just end it all, right? Anna then laughs and says, I'm just playing. Well, I have to go right now. Right? So we know in this scenario, Anna calls you. So it's a little different. Your access to resources kind of changes because this is no longer an in-person kind of interaction. It's now over the phone, right? And she wants to get off the phone, it seems, right? So going back to the SAVE acronym, right? With S recognizing what are those warning signs of suicidal thinking. I could read it again too. So Anna says, I've seen 5 apartments already. I don't know what's the point of doing all this apartment searching. No one seems to get me, and no one is really trying to help me. Things were easier when I was in the military. Maybe I should just end it all, right? Anna then laughs and says, I'm just playing. Well, I just have to go. I have to go now. And she tries to hang up the phone. But let's say she hasn't hung up the phone. So you want to keep her on the line and talk about what she means by ending it all. Yes. Yeah. Very true. Very true. Let's talk about your search. Confirm her location. She's overwhelmed, keep her on. Yes, I got a second that confirm her location. Part of what we do here, she's overwhelmed, keep her on, yes. Part of what we do here at the Bronx VA, whenever we have telehealth sessions with veterans in general, you kind of want to get that information at the very beginning. Hopelessness, yes. It's definitely a warning sign there, right? She doesn't know what to do, but you want to get that location and perhaps the location of where they are, if in case anything were to happen, you know where you can send help if in case it's needed, if in case it gets to that point, right? That's one of the first things you want to do when you're on the phone with someone, with a veteran, yeah? So S, right? So those warning signs, the maybe I should end it all is a sign, keep her on the phone, ask her where she is and what is, let me see if I can open this up. And what is she experiencing specifically? Hopelessness, someone else says here. Yeah. Right. Now we can move on to asking the most important question of all, specifically about suicide. You're on the phone with her and she just says again, she laughs after so she says first and foremost, maybe I should just end it all, right? And then laughs and says, I'm just playing. Well, I have to go right now. So let's say in scenarios like that, usually you might have just a few seconds to be able to ask any kind of question. So what would be that first question you ask to keep her on the phone?
Mr. Ronald,
Yes.
I have a question. Uh, if after we make the most important question, the person say, oh, no, 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 I'm just kidding or something. Uh, if we suspect that the person is at risk anyway, what should we do? What could we continue doing to try to get the problem?
Yeah, so if you think that you feel comfortable with asking more questions about suicide, specifically asking about, are you thinking about killing yourself? I would say continue with that question, that line of questioning. One thing that you can always do, which Allison also talked about earlier, is if in case that they're willing to still stay on the line with you, you can always do a conference call to the Veterans Crisis Line, where you will have a live representative who is trained specifically on handling suicidality and those kinds of things. That could be an option that you have. But you want to make sure you have that address, right? You want to keep her on the phone for as long as possible. And letting her know what are perhaps some available resources in the community that she can perhaps use, right? Yes, yes.
And I would also add to what Mr. Franco said is that also to just validate, like, validate the experience, like whatever the person came in discussing, saying that, well, you've been going through some really tough things right now. So I can understand if suicide, you thinking about that's like the most easiest thing to do. But I want to let you know that we are here to help. There's help available, and I would like to provide you with those resources. And even asking a follow up to say, well, if you were, who would you reach out to? Or if you were, what kind of things you would do, or to mitigate the crisis or decrease the crisis, right? Or when you do feel stress, what are some things that you do to address it? Because you're really talking about, like, yeah, things can be tough. What sort of tools do you have in your tool belt to help to decrease your risk and to help you to feel a little bit better?
Yeah, I agree. Definitely inviting. It's kind of like that safety planning aspect of things, right? Looking at step one is usually those warning signs, right? But steps two, as Allison said, is those internal coping strategies. What has helped in the past? What could you do now? Or what could you do in the future if this were to happen again? Yeah. I think here in the chat, someone said, "What do you mean by end it all? Are you feeling like harming yourself?" Someone said, "I would validate her being overwhelmed, then ask her if she plans to hurt herself." Yep. Yep. Yes. You're welcome, Jesus. Yep. So validating the veteran's experience, any other, besides the ones that were just in the chat, anyone want to think of any other validating statements that they can perhaps say to Anna here? Yeah. Okay. So what we'll do now is, I know we've talked about encouraging treatment and expediting getting help as well. So what we'll do now is I'll turn it back over to Allison, who will then close out the presentation. And then what we can do is open it up for questions more specific to perhaps what you do at your specific site.
So as I mentioned earlier, everyone, the Veterans Crisis Line is a real valuable resource. It connects veterans in crisis, and also there's the National Suicide Prevention Crisis Line for non-veterans. It connects the callers with qualified caring VA responders through a confidential toll-free hotline or online chat or text. Veterans, their loved ones, family members, and friends can call, and they offer support 24 hours a day, 7 days a week, and 365 days a year. So just so you have some context, back in 2020, we had more than 204,000 dispatches of emergency services to veterans, and over 1 million referrals to VA suicide prevention coordinators and case managers. So there we do have a large volume of calls, and people do use the crisis line. And also, if you happen to have someone who is a veteran and they are relocating, they're going to a different state, and let's say maybe they do have they are maybe are interested in even like in mental health, or just in learning more about VA services, that there are local VA SPCs at nationwide at every VA hospital in the nation. And and we have a veterans resource locator where you can find those names and addresses of the VA hospitals. And this is just a snapshot of what that website looks like. And we also have what's called our Reach Out campaign, which is rooted in the idea that during life changes, veterans can practice upstream mental well-being and get support. And in turn, supporters and stakeholders can be empowered to help veterans going through a life challenge or tough time. And also, we have another website called Make the Connection. This online resource connects veterans and their family members and friends to other supports, information, and solutions to issues affecting their lives as well. So we have a lot of online resources, and also tips on how to for safe storage of firearms, and also medications and other lethal means. So we really emphasize how it is to practice lethal means safety, and what does it actually look like to use a gun lock. And here are lethal means safety resources. We also have a brochure that provides step-by-step ways to reduce lethal means and how to access help for that. And also the VA has our mental health mobile apps for veterans who are either interested in self-help. We have our mindfulness coach, Beyond MST, which stands for military sexual trauma, our PTSD family coach or PTSD coach, and also for any veteran who has engaged in an evidence-based treatment, such as cognitive processing therapy, prolonged exposure, cognitive behavioral treatment for insomnia. We also have a couples coach, insomnia coach, even how to quit tobacco, and also COVID coach. And we also are able to through the mobile app download safety plans, which is in our PTSD coach app. And also coaching into care, which is a program for families and loved ones of veterans to help them them encourage a veteran in their lives to seek support, how they can coach their loved ones into getting care. It's also a national VA support line, and it's also 24/7 as well. And we also have for anyone who's interested in non-traditional complementary alternative medication options, we have what's called our whole health programs, we go over sort of like acupuncture, yoga. We also have like Tai Chi. So we offer these other resources to help to reduce risk and how to handle stress. We have our reducing stress group. And also there is our suicide risk consultation program, where if you are even a community provider, there's trained clinicians who can provide support in terms of like a case conceptualization, also doing like a risk assessment, like how to do a risk assessment, and also provide support after a suicide loss, what we call our postvention. Also talks about strategies of how to engage a veteran who may be at risk, how to document those strategies and risk assessments, and also, of course, lethal means safety counseling. They provide a consultation on all of these areas. And here's our postvention resources, where they offer support to the community, to providers, and within the workplace. Okay, and that's all. Thank you, everyone, and we'd like to open the floor for questions or thoughts about the training.
Great. Thank you both so much. That was amazing. I do see we have one request in here to, although everyone, we are sending these slides as well as the recording out, but would you be able to go back to the veteran crisis contact number slide?
Oh, yes,
Thank
I
you.
can do that.
While we wait for any questions to come into the chat. Also, while we wait, I am sending a short survey in the chat. If you were able to fill that out, it will help us identify future trainings that would be of use to you all. So we would really appreciate that.
And one thing I'll say quickly about the Veterans Crisis Line as well, part of what we do here, and I was a suicide prevention case manager before my transition into my new role, if a veteran calls the Veterans Crisis Line, typically that call will then be routed to the nearest VA associated that's closest to where the veteran lives, and then within 24 hours the suicide prevention case manager of the closest VA hospital follows up with that veteran. So that's just something that I think is very important to share, that we have consults that we receive. Sometimes it could be between 3 to 10 a day from veterans who call the Veterans Crisis Line, and within that moment after the call is closed, that is then sent to the nearest VA hospital, and the case manager, the suicide prevention case manager, usually follows up within 24 business hours. So just wanted to let you all know about that.
Great, thank you. See, there's a question asking if you get certificates for this. We're talking about like CEUs. Unfortunately, we are unable to provide those, but if you need something notifying like a supervisor that you attended, I'm happy to provide that. And we just launched a poll. If you're able to fill that out, that would be great. Okay, so I do have a question. What would you say is the best resource for veterans returning to civilian life who are struggling to adjust?
Well,
Well,
go ahead, Allison. Sorry.
So what the VA has is currently we have a transitioning support team located at the Bronx VA, where they assist military service members who are recently discharged and making that transition into civilian life. And there is a group that they can join, and also they can be assigned what's a case manager or social worker in terms of how they can acclimate back to civilian life, and also providing resources to help them to connect to VA care and a breakdown of what that may look like. So that is something that the VA does offer. It's actually a recent program. It started off as a pilot, and now it looks like we have it here at the Bronx, and what they're doing is trying to implement it in other VAs. I believe they had a full launch at the VA in Texas. So they want to make sure. So what they do is they also connect with the it's losing me, but they connect with the forts where the veterans, military service members are stationed, and so they have a list. They have a list of veterans, military service members who are being discharged, and they even provide connection with those individuals.
And with someone wondering how you refer how they can refer patients or veterans. Oh, you're muted, Allison.
Oh, yeah.
I'm so sorry.
Okay.
I can put in the chat the name of the program and the contact person.
Awesome.
I'll do that now.
And we have a request for contact information for the VA on Long Island.
So part of this, what the suicide prevention team does, so we work part of what's called the VISN-2, the Veteran Integrated Service Networks. It's essentially the VAs across the nation are split into about 18 different VISNs is what we call them, and we're VISN-2, so we do work closely with the suicide prevention team at the Long Island VA. I believe we may have a new suicide prevention coordinator there, Allison, if I'm not mistaken. Because the previous one has retired, but that's something that we can get to you following this training to get more specific point of contact at the Long Island VA. But we do work with them closely, so we can definitely provide that to you.
Great. I'll send that in the follow-up. Okay. So there's a question here that you might not have the answer to, but do you have any insights into why men are more likely to complete suicide more than women?
Yeah. So from what I could say, I think it has to do with the lethality of the means that's used. We know that firearms are the most lethal way to die by suicide. And we know that there are more men in the military than there are women, and perhaps that could be one of the reasons why. Also, just, I guess, historically, perhaps just from what we know, women may use less lethal means of suicide, attempting suicide, perhaps, whether it comes to medications, those kinds of things. So that's what I would say. Allison, I don't know if you'd like to add anything to that one.
Yes. So what the research has stated is that is correct. Is that men are it looks like that statistically they are more likely to access more lethal means to commit suicide, such as guns, firearms, and even attempting more lethal methods, like for example, like jumping from height. So they are more likely to utilize those methods to commit suicide,
Mhm.
and they are also even struggling with like less likely to even engage in outpatient mental health care. And one thing that the VA is now pushing with our initiative is to screen veterans for suicide in regardless of setting. That's why it's very important that we do outreach to community providers in different sort of like areas, because we found that 40% of our veterans who happen to die from suicide present for non-behavioral health concerns.
Mm,
So that's why it's very important to screen regardless of setting.
sure. That makes sense. And we just got a message in the chat, which was something that I was thinking about, just like in terms of like the stigma of like mental health and taking the step to access resources.
Yeah.
Maybe,
Yeah, so
yeah.
so as far as the each gender, I wouldn't know the answer to that, but we do know just in general with military, with veterans in general, there is a stigma with help seeking. There is this idea that you can do anything, you can get over anything, you have to be strong, you have to be brave, you're a veteran, you're a trained soldier. So because of those kinds of things, there is a stigma with just help seeking in general amongst veterans, I would say. Now, I'm not too sure about the feelings, emotions about the, I guess, the to each gender, what that kind of looks like, but in general, yeah, there is a stigma to help seeking when it comes to military veterans and service members, and yeah.
We have a question here about any resources for adults and young adults in mental health. I know we'll be sharing these slides, so I think that's a great resource to start with. And there are a lot of resources you guys shared. Is there anything else you guys specifically want to highlight, or any service that you think that you're, especially proud of?
One thing I would say in terms of like, for example, community resources, one thing that we find very helpful is I know that some of you may know this is NYC Well. You can connect with someone there, and they're able to connect, for example, like based on the insurance that a person has into various resources in their particular community. We've also used their mobile crisis team to perform wellness checks. So that's something that I would definitely encourage for young adults and adults in mental health to utilize the NYC Well.
Great, thank you. Any other questions? Just give it a minute. I haven't gotten any other questions. So I just want to thank everyone for participating in today's training. And I want to thank our two presenters for sharing what is really difficult information in such an amazing way. So thank you, everyone.